So, what are wounds? A wound is an injury to living tissue caused by a cut, blow, or other impacts, typically one in which the skin is cut or broken. Once wound occurs, the body tries to repair the defect, and the process of wound healing is a summation of a number of processes which follow injury, including coagulation, inflammation, matrix synthesis, and deposition, angiogenesis, fibroplasia, epithelialization, contraction, remodeling, and scar maturation. If the wound edges are opposed, healing proceeds rapidly to closure and are known as healing by first intention or primary healing. When the wound edges are apart, rapid closure is not possible and the body tries to fill the defect with help of granulation tissue, and the process is known as healing by secondary intention, and it results in the formation of scar tissue. Next, classification of wounds. According to Rank and Wakefield, wounds are divided into tidy wounds and untidy wounds. In the case of tidy wounds, they are incised, clean, healthy tissue, and seldom the tissue is lost. While in untidy wounds, they are usually crush wounds, contaminated, they contain devitalized tissue, and often tissue is lost. Moving on, in the case of tidy wounds are inflicted by sharp instruments and contain no devitalized tissue, and such wounds can be closed primarily with expectation of quiet primary healing. Surgical incisions, wounds from cut glass or knife, are classified as tidy wounds. In these wounds, the skin would be cut in a single and clean slash. Tendons, arteries, and nerves will commonly be injured in tidy wounds, but repair of these structures is usually possible. In the case of untidy wounds result from crushing, tearing, avulsion, vascular injury, or burns, and contain devitalized tissue. Wounds on the skin are irregular and multiple wounds may be present. There may be associated skin loss and exposure of tendons, arteries, and nerves. Such wounds must not be closed primarily and are often associated with problems during wound healing. The correct management of untidy wounds is wound excision of all devitalized tissue to create a tidy wound, debridement. The purpose is to convert a tidy wound into clean enough to let it heal by secondary intention. Some wounds may require multiple sessions of debridement. Then, in the case of management of tidy and untidy wounds, the differences are: in the case of tidy wounds, these wounds can be closed primarily with the expectation of primary healing, while in the case of untidy wounds, management in these wounds is excision or debridement of devitalized tissue to create tidy wound. Once it becomes a tidy wound, then it is allowed to heal by secondary intention or tertiary intention. Thank you.